Hi viewers, welcome to C-MEDITECH Online Academy's Kaps Recall Discussion session. As you all know, Kaps is the Knowledge Assessment in Pharmaceutical Sciences, which is an exam that is required for you to practice as a pharmacist in Australia. So in today's session, we will cover up the latest paper 2 questions that has come in the March 2024 exam. So now let's move on to the questions. So we have the first question here. Advantage of water in oil cream over oil in water cream. So we know these two are the bases used in ointment formulation. So let's see the ointment bases first. So we have four types of ointment bases that are oleogenous bases, absorption bases, emulsion bases, and water soluble bases. Oleogenous bases are basically oily in nature. And the emulsion bases are again classified into oil in water type of emulsion base and water in oil type of emulsion base. So now let's see the characteristics of these two types of emulsion bases. So both of them can be used as emollient or both of them have the emollient property. So now in case of oil in water type of emulsion base, they have water in the external phase and oil in the internal phase. So therefore, they are easily water washable, non-greasy, non-occlusive, and they can be diluted with water easily. For example, we have vanishing cream. And in case of water in oil type of emulsion base, they have oil in the external phase. So therefore, they are not water washable, greasy, and they would be occlusive in nature, and they have a shiny appearance when compared to the oil in water type of emulsion base, and they cannot be diluted with water. For example, we have cold cream. Okay, so in these types of ointment bases, as we already seen, the water is in the external phase in case of oil in water type of emulsion base, and in here in water and oil type of emulsion base, we have oil in the external phase. So therefore, they will have more shiny appearance and cosmetically they would be more appealing. So now let's come back to the question. So advantage of water in oil type of cream over oil in water type of cream would be option A, cosmetically more appealing. So they are more good looking in nature, right? So now let's go to the second question. So we have the second question here. Sorbitan esters are. So we have to know the nature of this sorbitan esters. So the first option is cationic, second option anionic, option C non-ionic, and option D none of the above. So now let's see the explanation. Sorbitan esters are also known as SPANs and they are non-ionic surfactants. So the characteristic is non-ionic in nature and they can be used as emulsifying agents in preparation of emulsions, creams and ointments, mainly for pharmaceutical and cosmetical purposes. So let's get back to the question. Sorbitan esters are non-ionic in nature. So the correct option is option C, non-ionic in nature. So now let's see the third question. So which pair affects the continuous IV infusion? Option A, LD and VD. LD means loading dose and VD means volume of distribution. Option B, VD and dose rate. Option C, half-life and dose rate. Option D, clearance and dose rate. So coming to the explanation, we know that in IV infusion or in the continuous IV infusion, the steady state of the drug or the drug concentration in plasma would be affected by dose and clearance of the drug mainly. So as we increase the dose of the infusion rate, then higher will be the drug concentration in steady state, or we can say higher will be the steady state plasma drug concentration. And to the clearance of the drug, it would be inversely proportional. So if the clearance rate is higher means then they would have a lower steady state plasma drug concentration. So more of the drug would be cleared from the circulation. So they would be having a lower concentration of drug in the plasma. So these two factors mainly affect the steady state plasma drug concentration in continuous IV infusion. So now let's get back to the question. So the pair affects the continuous IV infusion is option D, clearance and dose rate. Okay, so the clearance and dose rate would affect the continuous IV infusion or the plasma steady state drug concentration in continuous IV. So now let's see the next question, question number 4. Which of the following factors is not important for the Cockcroft-Gault equation. So we have to know what is this Cockcroft-Gault equation first. So creatinine clearance, or we are using the Cockcroft-Gault equation mainly for finding the creatinine clearance. So it is a formula for estimating the creatinine clearance of an individual. So creatinine is a waste product that is filtered out of the blood by our kidney. Okay, so creatinine clearance means it would be defined as the volume of blood plasma that is cleared of cleared of creatinine per unit time. Okay, so this creatinine would be filtered out by our kidney, and this indicate, or the creatinine clearance value will indicate that the kidney is functioning properly. So if there is any abnormal level of creatinine, then that would indicate a kidney disease for the patient. Okay, so we have creatinine clearance formula of Cockcroft-Gault. That is, creatinine clearance is equal to 140 minus age into body weight in kilogram divided by serum creatinine, that is milligram per dl. dl means 100 ml or deciliter, and that is multiplied by 72. And this Cockcroft-Gault formula is a gender-specific formula, or we can say this Cockcroft-Gault formula would be separate for male and female patients. So if the patient is female, we have to multiply with a 0.85 with the general formula. So creatinine clearance is equal to 140 minus age into body weight in kilogram divided by serum creatinine in milligram per dl into 72 into 0.85 if the patient is female. Okay, so age of the patient is needed for the creatinine clearance or using the Cockcroft-Gault formula. Then if we have to know if the patient is female or male, because it is a gender specific formula, we have separate formulas for both male and female. And we have to know the body weight of the patient. Also, we have to know the serum creatinine, right? So now let's go to the question and see. Okay. So which of the following factor is not important for the Cockcroft-Gault equation? So age is important. We need age for the calculation. Sex is important. We have separate formulas for male and female. So we have to know whether the patient is male or female. Then option C, serum creatinine. It is also needed. That is mg per dl. We have to know the value for the calculation of creatinine clearance. But we don't need the serum urea. So the factor which does not affect the Cockcroft-Gault equation is serum urea. We don't use this value and we don't need this value for the creatinine clearance using Cockcroft-Gault equation. Okay, so now let's see the next question. So we have question number 5. Magnesium stearate is a. So we have to know magnesium stearate is a which type of agent. We know that magnesium stearate is an excipient used in the tablet formulation. So we have to know the function of this ingredient particularly. So is that a lubricant, is that a diluent, or is that a disintegrating agent? So we have to study that magnesium stearate is a lubricant. Also, it can be used as an anti-adherent agent while we produce the tablets. Okay. So it is not a diluent, it is not a disintegrating agent. It is a lubricant. So magnesium stearate is a lubricant mainly used in the tablet formulation. Okay. So now that was about question number 5. So now let's move on to the question number 6. So we have question number 6 for renal excretion. So what is the condition for the renal excretion? So for a drug to be eliminated from the renal route, then the drug has to follow some condition. So what is that? Okay, so we have the options. Option A, the drug has to be polar and less plasma protein bound. Option B, the drug has to be non-polar and more plasma protein bound. Option C, the drug has to be unionized and lipophilic in nature. That is not possible, right? The drug has to be unionized and lipophilic in nature for drug absorption, not for excretion. So it has to be just opposite for excretion. So it has to be lipophilic in nature for drug absorption, and it has to be hydrophilic in nature for renal excretion. Hydrophilic means it has to be more polar in nature. Hydrophilic or polar. So we have to know this. For renal excretion, any drug has to be polar or hydrophilic in nature and it has to be less plasma protein bound. If it is more plasma protein bound means it forms a complex, or if the drug is plasma protein bound means the drug will form a complex with the plasma protein and it would be large in size and they cannot cross the cell membranes. So therefore, it cannot have high plasma protein binding. So here for renal excretion, the drug has to be polar and less plasma protein bound. So the right answer or the right option for question number 6 is the A. The drug has to be polar and less plasma protein bound in nature. So now coming to the question number 7. Which is the solvent used for slightly water-soluble compound? Or which solvent can be used for a slightly water-soluble or poorly water-soluble compound? So we know that water-soluble or water can be also called as aqueous medium, right? So aqueous medium, if the drug is not soluble in an aqueous medium means, then we have to use a non-aqueous medium for dissolving the drug substance. So non-aqueous means that is mineral oil. So the right option here is mineral oil. You can see dextrose. That's not the right option. Water. If the drug is not water soluble means we cannot use water once again, right? Then sodium chloride solution. We cannot use this sodium chloride solution as a solvent. So the solvent which can be used if the drug is less soluble in an aqueous medium is a non-aqueous solvent. And for example, mineral oil is a non-aqueous solvent. So mineral oil is a colorless, oily, almost tasteless and water insoluble liquid. For example, we have petrolatum and liquid paraffin. So these are examples of mineral oil and they can be used as a solvent for non-aqueous or we can use this mineral oil as a non-aqueous medium and we can dissolve whichever substances that are insoluble in water. And also they can be used as a lubricant in tablet production and also used as a hydrating agent in creams and ointments and also we can use it as a base or a non-aqueous solvent medium as I told you earlier. Okay, so the right answer was mineral oil. So now coming to the next question, that is question number 8. What is ion trapping? Okay, what is ion trapping? So let's see the options one by one. We have option A, alkalization of urine to increase the excretion of weakly acidic drugs. Option B, alkalization of urine to increase the excretion of weakly basic drugs. We know ion trapping means something related to the urine alkalization. And the only confusion is that we have to know whether it is weakly acidic drugs or weakly basic drugs. And option C, trapping of ions during the absorption of drugs, right? So ion trapping doesn't comes with the drug absorption. It comes with the drug excretion, right? So let's see the explanation now. See, ion trapping means it is the alkalization of urine for increased excretion of weakly acidic drug into urine. So in presence of sodium bicarbonate is used as an alkalizing agent. You can see when we add or in the presence of sodium bicarbonate, urine will be more alkaline in nature and that can excrete more amount of acidic drug into urine. Okay, and the most of the acidic drugs will be eliminated into alkaline urine. Okay, so that is the process of ion trapping. So we have got our answer. Now let's get back to our question. What is ion trapping? It is the alkalization of urine to increase the excretion of weakly acidic drugs. So option A is the right answer. Alkalization of urine to increase the excretion of weakly acidic drugs. Okay. So now let's get to the next question. Question number 9. Absorption of neutral drugs are increased by. So how can we increase the absorption of neutral drugs? So option A is given, increasing the partition coefficient or oil in water ratio. And the option B, decreasing the partition coefficient or oil in water ratio. Option C, by both A and B. And option D, none of the above. So how can we find which mechanism is used for increasing the absorption of neutral drugs? So we know that it is something related to the partition coefficient or oil in water ratio, right? So I will simplify the statements given. Okay, increasing the partition coefficient or oil in water ratio. So this will mean that increasing the lipophilicity of a compound. Okay, so now it's little more simpler, right? So we can see increasing the partition coefficient or oil in water ratio, or decreasing the partition coefficient or oil in water ratio. So that will mean that decreasing the lipophilicity. Decreasing the lipophilicity means that would be like increasing the hydrophilicity that is needed for the drug excretion. And now they are talking about the absorption. So that means we have to increase the lipophilicity. For a drug to be absorbed, it has to be lipophilic in nature, right? So it is the first option, option A, that is the right answer. For absorption of any drug or for absorption of neutral drug, we can use by increasing the lipophilicity of the compound. We can increase the partition coefficient or oil in water ratio, that is by which we are increasing the lipophilicity of a compound, and we can thereby increase the absorption of that drug. Okay, so we have to know that increased lipophilicity is needed for absorption of drug and hydrophilicity is needed for excretion of a drug. Okay, so now coming to the question number 10, that is isotonicity is not mandatory for one of the given formulations. So now let's see the options one by one. Option A, IV route. Option B, nasal preparations. Option C, SC route or subcutaneous route. And option D, ophthalmic preparations. We know that IV and SC are parenteral preparations, and nasal preparations and ophthalmic preparations, they are also needed to be isotonic in nature. So which option to be chosen? Okay, so we have the confusion here, right? So now let's see the explanation first. So isotonic solutions. So what are isotonic solutions in the first place? So isotonic solutions are the solutions with same osmotic pressure and salt concentration with biological fluids. So like blood and lacrimal fluid, right? So we have to have the solutions with same osmotic pressure and salt concentration with biological fluids. So these fluids are called as isotonic solutions. In SC, isotonicity is needed, but not essential as the drug is injected into fatty tissues, not to the bloodstream. So here, okay, so there is a spelling mistake. Okay, in SC or subcutaneous route, here isotonicity is needed, but it is not essential because we are directly injecting the drug into fatty tissues, not into the bloodstream. So if the bloodstream, we are injecting an isotonic or not isotonic solution into bloodstream, that will cause some problems. We know that RBC cells or red blood cells are having a very thin cell membrane. So they don't have a thick cell membrane around them. So if we are using any kind of hypertonic solution or hypotonic solution, so that will cause complications. You know, hypertonic means solutions with higher salt concentration and hypotonic means solution with lower salt concentration. And isotonic solutions will be having a equilibrium or same level of osmotic pressure and salt concentration with the biological fluids. So here what happens in the hypertonic solution means the RBC cells will shrink and crenation of these RBC cells will happen. Okay. And also in the case of hypotonic solution, here the RBC cells will swell by having or by absorbing the water from the solution, and after the maximum capacity they will burst. So therefore cell lysis happens. So that is the problem occurs with hypertonic and hypotonic solutions. Okay, so we have to know in SC route we are not directly injecting the drug into the bloodstream, we are injecting the drug into fatty tissues. So therefore in SC route it is not mandatory to have the isotonic solution. So now let's get back to our question. So the right answer for option question number 10 is option C, SC or subcutaneous route. Okay. So now coming to the question number 11, we have question number 11, that is central vein injections are used for what purposes? So for short-term therapy and option B long-term therapy, option C both and option D none of the above. Okay. So central vein injections are used for which purpose? Is that for short-term therapy or long-term therapy? So let's see. So in IV drug delivery, we have two types of injections. So peripheral vein injections are there and central vein injections are there. Okay. In peripheral vein injection, it would be a short-term therapy and we cannot administer any kind of irritating solutions via this route. So in here route or in this route, we can say the peripheral in vein injection, it has to be isotonic. So the solution has to be isotonic in nature. And in the central vein injection, it is used for long-term therapy, and we can use irritating solutions like hypertonic solutions can be administered in the case of central vein injection. So here we'll be using large veins from the thoracic cavity, and here in peripheral vein injection, we'll use dorsal portion of forearm. And here we can use a peripheral IV catheter, and in the case of central vein injection, we can use a central line catheter. Okay. So now coming back to the question, central vein injections are used for what purpose? That is long-term therapy. Option B is the right answer. That is long-term therapy. So now let's see the question number 12. Tragacanth is a which type of gum? So we have options. Option A, synthetic gum. Option B, semi-synthetic gum. Option C, gum of mineral origin. And option D, vegetable gum. So Tragacanth is a naturally obtained gum, and it is obtained from the several species of Astragalus. Mainly we can say the source of Tragacanth is Astragalus gummifer, and it is used as a suspending agent, emulsifier, thickener, and stabilizer. So as you can see, Tragacanth is a natural gum. So now let's come back to our question. So Tragacanth is a vegetable gum. It's given in other words, so it is vegetable gum. Okay, so coming to the 13th question, separation of upper crown in a tablet is called modeling, layering, capping, and picking. So we have the option A, modeling, that is the unequal color distribution on a tablet, right? And layering means it is the separation of tablet into different layers. And capping, yes, this is our answer. Capping means it is the separation, partial or complete separation of upper or lower crown in a tablet is called capping. Okay. So coming to the explanation, as you can see, it is the partial or complete separation of top or bottom crown of a tablet. And why this capping happens? Due to air entrapment during the compression of tablet, and therefore there would be subsequent expansion of the tablet on ejection from the die. So when we eject the tablet from the die, there would be a subsequent expansion of the tablet due to the air entrapment. Okay. So now our right answer is capping. So coming to the 14th question, what or which of the following is not related to tablet evaluation test? So we have we know that we have different types of tablet evaluation test used in the pharmaceutical industry. So let's see the test one by one. We have official test, weight variation, disintegration test, dissolution test, drug content. And in non-official test, we have hardness test and friability. This is according to USP. You may find it different when you see the IP. Okay, so in the IP, evaluation test of tablets will be different, but this is according to the USP. Okay, so now let's see the question once again. Which is not related to tablet evaluation test? Friability test. We are using the friability test for finding the fibrillation, or the breaking capacity, or for the tablet. And disintegration is a tablet evaluation test. Dissolution is also a tablet evaluation test. And option D, difference in weight not more than 2.5%. Actually, there is weight variation test, but that doesn't correlate with the option given. It is not more than 2.5%. So this is not a limit that can be related to any of the tablet evaluation test. So it is the option D, which is not related to tablet evaluation test. All the other three are related to tablet evaluation test. Okay. So now coming to the question number 15. Question number 15 is here. Yeah. Which of the following statements regarding clearance is not true? So we have to know what is clearance, right? So clearance means it is the volume of blood cleared of drug per unit time. So what is clearance? It is the volume of blood cleared of drug per unit time. So we have three types of clearance. This total body clearance, hepatic clearance, that is by liver, or hepatic clearance is the volume of blood cleared of drug per unit time by liver, and renal clearance is the clearance that is done by the kidney. Okay, so total body clearance will be the sum of the hepatic clearance and renal clearance, and we have a formula here. Clearance is equal to Ke into Vd, and Ke is the elimination weight constant, or K. And then that is multiplied with VD or volume of distribution. And then let's see the factors affecting clearance as well. Physicochemical properties of drug, plasma concentration of drug, distribution and binding characteristics of drug, urine pH, blood flow to kidney and liver, biological factors, drug interactions and disease state. Okay, so now let's get back to our question. Which of the following statements regarding clearance is not true? So it is option A. It depends on T half. Clearance doesn't depend on T half. T half depends on clearance, but it is not reverse. So the clearance is not depend upon clearance. So this is the right answer. And all the other statements are correct. It is required for the steady state drug concentration and continuous IV infusion. We have studied this in the previous question. And option C, it is the drug removal from the body fluids in a specific period of time. Yes, that's right. It is the drug removal from blood plasma in a specific period of time. And it is the wrong statement that clearance depends on T half. So that's it for today. So we'll meet you again, guys. Thank you. Bye-bye.